Hello friends, welcome to a new chapter today. The third picture which you see in Etter's Atlas, which is the lateral wall of the skull. This lateral wall of the skull, there is one more name which is called as norma lateralis. Okay, this lateral wall of the skull is called as norma lateralis. So first we will see the bones which you are going to see in the lateral wall of the skull, and then we will see the rest of the things which are necessary. Okay, so if you see in the bones which are seen in the lateral wall of the skull, these include, first we have the yeah, so this is the frontal bone, right? In the lateral wall of the skull, this is the frontal bone. What is this bone called as? Sorry. Okay, yeah, what is this bone called as? This bone is called as the parietal bone. Sorry, this is the temporal bone. Sorry, I'm really sorry. This is the frontal bone, this is the parietal bone. Okay, this bone which you are seeing here, this is this one which you are seeing, this is the temporal bone. Okay, and this bone which you are seeing back, this is the occipital bone, right? Then this, what is this? We have already seen in our last class. This is the zygomatic bone. Okay, then what is this bone which you are seeing here? This is the maxillary bone. Okay, this bone which you are seeing here, this is the mandibular bone. Okay, so these are the different bones which you are seeing. So once we have seen the bones which are seen in the skull, we will even see the sutures of the skull. Okay, what is this suture called as? This suture which is present between the frontal and the parietal bone, what is this suture called as? This is called as coronal suture. Okay, the suture which is present between the two parietal bones. Here you have sagittal suture, but we are not able to see this sagittal suture anyways. Okay, then the suture which is present between the occipital bone and the temporal bone, here and on both the sides, see, occipital bone and parietal bone. So this suture, see, this is the parietal bone. So this bone I'm writing here, okay, and this is the occipital bone. So this is the second parietal bone which is seen on the opposite side. This is the occipital bone. This parieto-occipital suture, this, if you see, it looks like a shape of a lambda. So this is in the shape of the lambda, right? So that is the reason why this suture is called as lambdoid suture. Okay, this is a lambdoid suture here. And then we have one more suture which is called as parietal, between the parietal bone, this part, this suture which you see between the parietal bone and this temporal bone. What is this suture called as? This suture which is present between the parietal bone and the temporal bone, this suture is called as parieto, as the name says, parieto, and this is not temporal, this is the squamous part of temporal bone, so it is called as parieto-squamous suture. Okay, so these are the different sutures and the bones which are seen in the lateral view of the skull. So let us now learn about the features of the lateral view of the skull. True, we have learned about the bones. Now let us see the features. So in the features, if you see, the main important features which you see in the lateral view of the skull are, see, this line is called as temporal lines. We have two temporal lines, we can say. See, this temporal line will commence from the frontal process of zygomatic bone. See, this is the zygomatic bone. So from the, this is the zygomatic bone. See, this is the zygomatic bone. So from the frontal process, this is the frontal process of zygomatic bone. So it starts from the frontal process of zygomatic bone, and then as you see the dotted lines, it arches upwards, okay, across the frontal bone and then crossing the parietal bone. Okay, and in the parietal bone it splits into two sutures like this. Okay, two lines in the parietal bone. This line splits into two lines. Okay, and if you see, the superior line is faded away, whereas the inferior line, you can see the prominence which you see in the inferior temporal line is prominent, and this will go forward across the squamous part of the it is going like this, and it is going to the squamous part of the temporal bone. So this is the squamous part of the temporal bone. It is going to the squamous part of the temporal bone, and it is continuing as supramastoid crest. So this is the supramastoid crest. Okay, so this is called as temporal line. The superior part we have the superior temporal line, and inferior part we have the inferior temporal line. Okay, this you should remember. So let me tell you again. So if you see, this is the zygomatic bone. So this is the frontal process of zygomatic bone. So from the frontal process of zygomatic bone, a line arises and it passes, curves, and it goes forward and curves again backward, and it goes around the frontal bone followed by parietal bone. In the parietal bone, it divides into two lines. One is the superior line and the other is the inferior line. Superior line is less prominent when compared to the inferior line, and these two lines will cross with each other, and at the end this line continues backwards and reaches the temporal bone. And here in the temporal bone, in the squamous part of the temporal bone, they continue has this line which is called as supramastoid crest. Okay, so this is the temporal line. Then what is the next prominence which you see in the lateral side of the skull? In the lateral side of the skull, next important thing is this one. What is this called? This is called as zygomatic arch. This is called as zygomatic arch, which you see. This zygomatic arch is a horizontal band bone which is formed from the temporal bone, a process of zygomatic bone, and zygomatic process of temporal bone. See, this is the zygomatic. What is the zygomatic arch formed of? This is formed of zygomatic bone, and it is formed of, this is the temporal bone. It is formed up of temporal bone and zygomatic bone. Okay, so this is the temporal process of zygomatic bone, and this is the zygomatic process of the temporal bone. Okay, both these form the zygomatic arch. This zygomatic arch continues forward, has this temporal line. It continues forward, has temporal line, and it continues backward, has supramastoid crest, which again continues, has temporal line. Okay, so this is about the zygomatic arch. Then we have in here one more important landmark you see here is this one. What is this called? This is called as external acoustic meatus. Okay, then there is one more important landmark here which is important in ENT and asked many a times, which is called as, there is a name for it, that is suprametal triangle. We call this as suprametal triangle. What are you going to see in the suprametal triangle? It is bounded above by supramastoid crest in front. So this is supramastoid crest which you are seeing above. Okay, and then behind, see, in the front, okay, in the front part, it is bounded by this external acoustic meatus. Okay, this is, sorry, external acoustic meatus, and behind it is formed by a line joining the supramastoid crest and the external auditory meatus by a vertical tangent passing posterior to the mastoid. Okay, so this is suprametal triangle, and if you see, this suprametal triangle is the landmark for mastoid surgeries. Why? This mastoid is 1 point, and this mastoid is 1 point, see, this number is important, 1.25 centimeters deep. Okay, deep to this triangle. Mastoid is present 1.25 centimeters deep to this triangle. And one more important thing is in the antero-inferior part of this triangle. So let me show you again. So this is the part of this triangle. So I'll just draw the triangle, right? So this is the triangle, okay, which you are seeing, suprametal triangle, and in the lower part of this triangle, in the anterior inferior part of this triangle, there is a spine like process which is present, which is called as suprametal. This is called as suprametal spine, or we can also call it as spine of Henle. This is suprametal spine or spine of Henle is present here in the anterior inferior part. Okay, next what are the important things again? There is something called this part, this one which you see here. What is this part called as? This is called as mastoid process, which is important here in the lateral view of the skull. Then you have something called as Asterion. What is this Asterion? Asterion is the meeting point of parieto. See, this is parieto-mastoid, occipito-mastoid, and also lambdoid suture. See, this is the lambdoid suture, right? And this is the mastoid process. This is the temporal bone. In this temporal bone, this is the mastoid process part. So this suture, what do we call this suture as? This suture we call it as occipito mastoid suture. Okay, and this suture, if you see this suture, we call it as, this is the parietal bone, right? So this is parieto-mastoid suture. Okay, and this is nothing but, as you know, lambda suture. So this joining point of all the three sutures, this part is given a name which is called as Asterion. Okay, this is called as Asterion. Then what else do you have? Here there is one more important thing. This spine, if you see, this is called as styloid process. What is this called? This is called as styloid process. Okay, and then you have a fossa which you see here, which is a temporal fossa. So I'll write in other thing. Here this fossa, here the fossa which you are seeing here, this fossa is called as temporal fossa. You call this fossa as temporal fossa. Okay, so let me show you the temporal fossa again. Okay, this fossa which you see here, this is the temporal fossa. So what are you going to see in this temporal fossa? This temporal fossa is bounded above, if you see, this is bounded above by this line which is called as temporal line. Okay, as I have already told you the boundaries of this temporal line, it is bounded above by the temporal line. Okay, it is bounded below by this arch. What is this arch called as? Zygomatic arch, right? This is zygomatic arch which is bounded below. This temporal fossa is bounded above by the temporal line, below by the zygomatic arch. And what is this crest called? This crest is called a supramastoid crest. Okay, it is bounded below by zygomatic arch and supramastoid crest. Okay, this supramastoid crest also continues laterally. Okay, and medially, what does it have? Medially, it have infratemporal crest of sphenoid. Okay, and this is the temporal fossa. And if you see, if you put a hand inside this temporal fossa, this fossa or your finger will continue below. Okay, and this is which is present below, this is called as infratemporal fossa. So we will see the infratemporal fossa. Okay, so here we will even see the infratemporal fossa. So what is infratemporal fossa? Infratemporal fossa is present behind this. See, behind this ramus of mandible, here you have the fossa. See, below this, behind the ramus of mandible, the fossa which you see, this is called as infratemporal fossa. This is called as infratemporal fossa, right? We have supratemporal fossa which is present here, and this is present below the temporal bone, and this is infratemporal fossa. Mind you, this is below the mastoid, not above the mastoid, because I can't draw below the mastoid, so I am drawing it like this. Okay, now there is last and final important thing here is about one point. I have already told you about the Asterion, right? Where is Asterion? Asterion is this point which is the meeting point of the lambdoid suture, uh, parieto-mastoid and occipito-mastoid suture is called as Asterion. This meeting point is Asterion. There is one more meeting point of four bones. That is, this is the frontal bone. Okay, this bone, I didn't tell you what this bone is, right? This is the greater wing of sphenoid. Okay, the meeting point of the frontal bone, greater wing of sphenoid with temporal bone and the parietal bone. Okay, this meeting point which you see, this is given a name which is very important, and this is the terion. Okay, one important landmark of this terion is here in the terion there is an artery which is flowing through this terion. Okay, and this artery which is flowing through this terion is called as there is name for this artery which is very important. This is middle meningeal artery, passes through this terion, and this middle meningeal artery is very prone to bleeding at this plate and at this site, and as a result it is very difficult. Okay, as a result this fracture of this temporal bone might cause rupture to this middle meningeal artery, and this can lead to extradural hematoma. Okay, so this is about the lateral view of the skull. So thank you guys for watching my lecture. In the next class we will see the basal view of the skull. Thank you for watching my lecture. Thank you.